Today we are going to talk about approach to a patient who has been poisoned or has consumed and we don't know the nature of the same. The study of toxicology, toxiconetics and toxidynamics is, as you know, known as, you would have studied in forensic medicine. Toxicology is a study of poisons on of functioning of living systems. Toxicokinetics is the absorption and distribution, excretion and metabolism of toxins, toxic doses of therapeutic agents and their metabolites. I'm so sorry about the spelling mistakes, but you get the idea. Toxicodynamics is used to denote the injurious effect of toxic substances on vital function. So these are the major terminologies that you need to actually know about. Okay. Sorry about the Greek as well. I don't know what happened there, but it basically says approach to the poisoned patient. And of course, we generally find that there are going to be some quick mental and physical changes that happen. We're also going to find that bystanders play a key role. Like I told you last time, it's very important that you find out what the patient bystanders get to know. I don't know if some of you will remember, I told you last week, maybe I completed or didn't complete the subject, I mean the topic, I'm not sure. So bystanders play a key role in bringing what was found near the patient prior to the consumption, in getting to know, in getting to know what exactly happened and what exactly were the sequence of events. So I told you last week that there was a patient who had presented to us in the what do you call it, into the casualty with history of possible seizures when he was playing carom. And I told you guys that I was particularly insistent that it was a pseudo seizure because there were no clinical findings after that. He turned out to have seizure disorder, and he turned out to have anti-epileptics in his bag, which he had not been taking. So he did well and he got discharged, so all is well. But like I said, the role of bystanders is very important. The most common routes of exposure and poisoning are inhalation, ingestion, injection, and there are a couple more I'll elaborate on a little later. Toxic chemical reactions compromise of cardiovascular, respiratory, CNS, hepatic or and renal systems. So you can find drugs that cause toxicity that can include drugs, insecticides, herbicides, plant toxins, animal toxins. Envenomation comes as part of this, remember. Chemical weapons, radioactive elements. Of course, you guys all know about the recent events. Was it Telangana, wherein we had the gas leak and we had issues with that, and Bhopal also, obviously that was a major one. And there have been incidents here and there, but of course they don't really always come to light. Okay, chemical agents that can cause, pesticide poisoning is the most common in India, and many other poisonings are emerging, like alcohol, sedative use, antipsychotic use, antidepressant, cardiovascular drugs, analgesic drugs, antimicrobials, herbal and plant products, household materials, homeopathic medicines, and illicit drugs. Of the consumptions that we are seeing recently is especially homeopathic agents that claim to prevent um, uh, the whole COVID-19 illness itself. They say it is claimed that taking arsenic medications, I'm sure most of you would have gotten it on your WhatsApp, or some people would have asked you about it. And many people are saying, I mean, the homeopathy branch of medicine is claiming that consumption of arsenic in small doses will prevent infection with COVID-19, even if it is transmitted, you will prevent infection as such. But the thing is, a couple of chemists in Tamil Nadu took it a little bit more seriously, and they actually OD'd on the arsenic, or did it, or made it the wrong way, and both of them died. Okay, so now we'll have to start looking for these kind of things: your alternative medication overdose or inappropriate consumption, all of these things. Because in a time like this, your people are going to clench the straws, right? They're going to clutch. Sorry, they're going to clutch the straws, and they're going to try to look for ways to prevent infection, etc. So like I said, apart from injection, ingestion, inhalation, we also have exposure through skin. When you do find a patient and there is history of unknown poisoning, do take precautions. I always tell you this, you come first. You are going to be a doctor. You can make a difference to many lives. Everybody's life is important. Yes, all lives matter. Yes, I agree. But it matters that you are able to provide to society, so you keep yourself safe so that you can continue that service and save more lives. Remember that always. So wear gloves and examine this patient, because you don't want to get exposed to the contaminant either, because you don't know what exactly it is. Okay. Okay. Also, the kinds of poisonings that we see are different in different environments. Many a times we see poisoning in a healthcare environment, which is not very often seen here in India as such. But in the healthcare environment, what happens is we have access to certain drugs. Like there is a in CMC we used to have a nurse. I've forgotten what they were correctly designated. They have the key to the opioids cupboard and all the narcotics and all those things, where they're kept. I've forgotten what their designated names are. But we had one of the nurses, and they go on rotation basis. So for 1 week they have to manage the key, and every day on random on every day, but on random inspection. Audit used to be done to make sure that nobody is consuming and nobody is misusing the medications as such. Documentation for each and every drug that is used has to be done. So many a times in the healthcare environment, because of easy access to medications, drugs, there is neglect, or there is commission or omission, and it leads to lots of problems. Okay. And then you can have inadvertent over ingestion, okay, like heroin, cocaine, by mistake. He forgot to take his previous dose, or she forgot to take his previous dose, and she ODs on that. Household cleaning products. This is again very, very common in our setting. Many a times, probably even in our own homes, you're going to find that patients have consumed. This happened maybe about 6 months back. A boy came, not 6 months, maybe 3 months back in the casualty. A boy came home to his friend's house, and he was very thirsty. So he opened up the fridge and he found a 7-Up bottle, and he just took a nice big swig, only to find out that that was, what was it, bleaching agent or something like that. I'll tell you. I think a phenol. It was phenol. No, it was bleaching agent. It was luckily diluted bleaching agent. So he spat out what he could have. Initially, he thought the taste was weird in the initial swig, and then as he continued to drink, he was very thirsty. So he was trying to consume a lot, and he was admitted with us for about 3 to 4 days. Luckily, he vomited a lot of it out, so there was no long-term problem as such. Okay, so what happens is, even kids inadvertently go and ingest these things. The most important things that we tell any parent, you and I also, yes, recycling and all that is good. Even I promote that a lot. But the thing is, label properly, or do keep it in a way, in a place that only you can reach. Or if it's just 2 adults or 3 adults in the house, make sure that everybody around knows where it is. That particular bottle should not be kept easily available, so that nobody can inadvertently, in even an inebriated state, reach out and try to consume it. Okay, so don't keep these things in the fridge. Don't keep them in a place where children can reach, like the bottom of the bottom cupboard of the sink. Those are very easily reachable for the kids, and they see 7-Up bottle and they're like, I like 7-Up, and they, consume. That's happened too. Plants and pesticides, paint products, varnish. Many a times, there are a couple of painters who had come, the masonry, the painters, the building painters, and they had come having consumed varnish. Okay, it's a very artistic way of trying to off oneself, but very difficult situation for them also. It's sad. Okay. Well, sometimes because of mental or visual impairment, illiteracy, the language barriers, older adults may even ingest incorrect amounts of medications. I had told you this about this last time when it comes to hypoglycemia. Sometimes elderly patients forget that they've taken their old glucose lowering agents and they consume again and they go for hypoglycemia. So that's not known. Sometimes they will be found alone in their home by the house help, in an unconscious state or in an altered sensorium state, and they don't know what has happened. So a list of medications that is generally taken by the person, elderly or young, whatever the case may be, must be produced to be seen by the doc. Okay. Toxic fumes at home. Burning wood, gas, oil, coal or kerosene produces carbon monoxide. It is a colorless, odorless gas. It's non-irritating and it makes it specifically dangerous. It causes cellular hypoxia and carbon monoxide, cyanide fumes, hydrogen sulfide. Hydrogen sulfide, at least you can smell it. Cyanide, I don't think has a very significant difference in the smell as such even. Okay. Initially, the patient will present with tachycardia, hypotension, severe lactic acidosis and ischemia. Okay. ICU care is needed. Intentional and suspected suicidal overdose can also be suspected. Frequently, the patients may have mental illness, underlying mental illness, substance abuse problems, or both. Often with withdrawal, sometimes what happens is those who are on the medications or those who are on the substance abuse, you know, bandwagon will go in for withdrawal, and the entire picture is confusing then sometimes because you don't know exactly what's going on. There was a consultant who used to say this was a joke, take it as a joke, but a consultant used to say we used to come across a lot of alcohol withdrawal patients, and what used to happen is some of the time, whatever, no matter how much you do, you keep them restrained and all that, they just don't get any better. They take a lot of time to improve. Sometimes, you know, unofficially, they would tip the bystanders to get some alcohol and actually give the patient some alcohol, because that was the only way at that point in time to be able to get the patient a little improve a little bit. So it's really confusing sometimes. But again, like I said, Hippocratic oath, your ethics come into play, everything comes into play. So that decision is entirely yours to make, and that burden is entirely yours to shoulder. So it's up to you. Okay. A toxidrome, as you know, is a group of signs and symptoms associated with overdose exposure to a particular category of drugs or toxins. And it's commonly observed in poisoning or drug overdoses, but certainly is not limited to carbon monoxide salicylates. Most of them present with lactic acidosis. That is what it says. I have a picture of toxidromes that you should remember. If you remember that, I think that would make a big difference to you guys. How does a poison patient die? Most of the times, if it's an hallucinogenic, they get themselves into trouble, get themselves into a fight, or they go to high places and they have a fall. A lot of the times it's because of aspiration. Okay. When it comes to a patient who's in your casualty having an unknown poisoning, you have to look for whether there's bradycardia or tachycardia, whether there's hypothermia. And these are the clinical signs and symptoms I can point towards a specific toxidrome. At the bottom, I have given you the link of API India journal that I had got some of this data from, which I think is a good easy read for you guys as well. So you guys can just click on the link. I'll upload the presentation next week because I want to shorten it. This is almost a 150 slide slideshow presentation for the class, which is a little it's a little too long. So I'll split the class into two, but I will upload the PPT next week when I want to shorten it out. I tried this week, didn't happen. I want to work on it a little better and make it a little bit more interesting so few things can stick on. Okay. So anyhow, I will send you the link probably by next week, but you can screenshot and just look. API India, look for approach to unknown poisoning. Like I said last time also, you need to know the odor of certain things. OP poisoning, or organochlorine also, you must know the smell. If you have enough patients coming to you, like Prashant from medicine has very, very good experience. For us staff, Naga Shetty sir, Nitish Pandari sir, excellent in consumptions. And then the next person is your Prashant Hubli. He has seen so many poisonings, envenomations and all of that when he was working in Dharwad, that he has very good experience with all of that. So he knows all the odors. I literally ask him, come sniff, let us know what this is. Okay. And this is the table that I was talking about. That's a toxidrome table wherein you can talk about cholinergic syndromes, nicotinic syndrome, anticholinergic syndromes, opioid sympathomimetics. What are the symptoms and what are the common causes? In our setting, many of the times it is a consumption of a household cleaning product or a pesticide, and then your benzodiazepines come in. Now, when the benzodiazepines come in, it becomes a little irky. I must have told you about this kid who came from Bengre area. I'm not sure how many of you know what Bengre area is. Bengre is sort of an island that is situated off the coast of Mangalore as such, and you actually need a ferry to go there and come back, preferably. I'm not sure, I've not been there myself, but there was actually a drug ring out there. This was in the early 2019, late 2018 preferably I would put it. And this kid came with overdose of nitrazepam, and that was the time when our doctor's prescriptions used to get stolen. It was a very awkward thing. Finally, they got hold of the guy, I think, who was in charge of the drug ring, and numbers have come down. It must be still going on, but we don't see many cases coming in from there, or they take them to Wenlock because it's a lot easier. For us, we follow up every medical legal case from Wenlock. They probably have their people over there to sort things out for them, the drug lords, I mean. So this fellow came in a very drowsy state, and he was found next to lots of medicines next to him, and he was drowsy, and he was brought to the casualty, and it was a little they brought the medicine, so we saw that it was nitrazepam. We could trace it back. We saw the medication. There was no prescription, obviously, but we saw the medication, and we compared it. There are apps that can help you see what kind of medicine it is, and we were aware of this nitrazepam scam that was going on because many of the doctors' prescriptions went missing. So you won't get nitrazepam from a chemist or a pharmacist unless you have a prescription. And even if the guy is a little corrupt, he will still want a prescription because it's a notifiable drug that you need to give. So a lot of doctors were complaining about it, and we're like, okay, we have to keep an eye for this. And this is what happened. This guy came in, and within 24 hours, the bystanders just took him home. They were so scared of police action. This guy hopped up on many things. It was not only nitrazepam, there were other consumption also. I think he had smoked a little bit of marijuana as well, and there must have been something else, but they just refused treatment because he was on the improving side. He had OD'd a little bit, and then now he was getting better, so they just picked him up and they ran before we could intimate the police properly and all of that. And they were creating some problems for us also, so we had to discharge against medical advice and notify MLC. And then after that, what happened to that kid, I don't know, but I'm sure they would have been able to negate any kind of action that would have been taken. When this patient comes in, apart from doing a clinical examination, obviously it's really important to do a chem profile. You want to do biochem like sodium, potassium. You want to look for the ABG to look for acidosis, because acidosis can point you in the direction of a salicylate or a paracetamol poisoning that needs to be started treatment, for which treatment needs to be started off very soon. Okay. Metformin rarely causes lactic acidosis, and ECG needs to be taken to see that, ECG is immediate. Chem panel is going to take you easily minimum 20 minutes to come in, minimum. Okay, even the ABGs give us electrolyte profile and ABG profile, but what happens is the patients have, the ECG will give us an immediate idea about the potassium and any other electrolyte abnormalities that can happen. So ECG is really important, and documentation in these cases is very important because these are mostly medical legal cases, and they can really go through the entire case sheet to make sure that everything is in place. Okay. Tox screening is sometimes sent in our hospital. Every lab has its own set of tox screens. So depending on what they want, it's a corporate thing. They decide what kind of panel has what screening tests. So most of the times what happens is we do get some kind of an idea as to what is going on. Like in that kid from Bengre, one of the brothers came and told us, without the knowledge of his parents and his other friends, he came and he told us, see madam, he is involved in drugs, he has a bad habit, he disappears for days on end. I am aware that this is happening. I've tried to get him to stay back, and that was what the fight was about. That's why he OD'd. These are the medicines, and here you go. And also, the drug involved in all those things. The patient parents were refused. Patient party actually told us he has a fever, to make it look like that it is not possibly drug related. Of course, there was no fever when he came here. It was all very, very fishy. Okay, I think what I'll do is I will stop here because I will go now. It's the specific toxidromes. Okay, so I will take that tomorrow. I mean, not tomorrow, next week. Okay. Yep. Thank you. Thanks, guys.